All right, so tell me what brings you in here today.
I have lower back pains
Lower
and I
back
have leg pains.
Okay, where specifically are you feeling your low back pain? Stand up and show me.
About right here.
Right here?
Yeah.
Okay, do you ever feel anything up here?
No, not really. Just mainly my lower back, right here.
What about on this side?
No.
Anything on this side?
Nope.
Okay, and you said you're having leg pain?
Yeah, it'll start from my hip and it goes down just above my right knee.
Okay, so it wraps around here?
Yeah.
Does it ever go below your knee?
No.
Anything back here at all?
No.
Okay, and anything down the other leg?
No.
Okay. All right, so let's just kind of talk about those pains specifically. What type of pain are you feeling in your back? Sharp, dull, achy?
It's sharp pain.
Sharp pain?
Mm-hmm.
Okay. And then is that pain always there, or does that come and go throughout the day?
No, it comes and goes throughout the day. And
Okay.
it doesn't happen every day, but
Okay.
it comes and goes.
Comes and goes.
Mhm.
And then at its worst, what level does that get to out of 10?
About a 7.
7 out of 10. Okay. And then at its best, what does it get to?
About a 3.
3. Okay. But then sometimes it could be at a 0 depending on the day.
Yeah.
Okay. And then what about the pain in your leg? What type of pain is that?
That can get to about like a 6 to 7.
6 to 7 out of 10?
Mhm.
And then is that sharp, dull, achy?
Sharp. And it comes in waves as well.
So that kind of comes and goes throughout the day?
Yeah.
Okay. Do you feel like the two pains are related? Do you notice if this pain gets worse, then this one gets worse? Or do you think they come on at separate times?
They come on at separate times.
Okay. So you haven't really noticed a pattern between the two?
No, because my leg pains haven't been consistent enough
Okay.
to make a
Got it.
pattern.
Okay. And then have you noticed that this leg pain, is there any numbness or tingling at all?
Yeah.
There is numbness and tingling? And do you have any numbness or tingling in your back?
Sometimes.
Okay, sometimes. What about any pins or needles?
No.
No pins or needles?
No.
So we're just going to kind of talk about some activities that make your symptoms worse. See if you found anything throughout the day that seems to irritate your symptoms.
If I lay flat on my back
Okay.
for about 10 to 15 minutes, I start to feel the pain.
Okay, what type of surface are you laying on? Is it bed, on the floor?
It could be a bed, it could be the floor, it could be anything. When I'm laying flat with my legs straight out in front of me.
Okay, so like straight out. What about if
Yeah.
you bend your knees? Does that change anything?
Sometimes that actually helps.
Okay, okay. So, and then does that bring on your back pain? Does that ever bring on your leg pain?
Not really.
Okay. And then once you're, so you said about laying 10 to 15 minutes, how
Mhm.
high does that pain get to? Does that get to your 7?
7 or an 8.
7 or 8 out of 10. Once you get up and you start moving around, how long does it take for your symptoms to go back to 0?
About 3 to 5 minutes, depending on what activities I'm doing.
Okay. Anything else throughout the day that irritates your back pain?
If I stand for a long period of time, then
Okay.
yeah, I can start to feel it.
How long are you able to stand before you start noticing that increase in your pain?
About a half hour.
Okay. And then does that get to a 7 or 8 as well?
It can.
Okay.
Not all the time.
And then what do you kind of do to relieve that pain? Do you just sit down?
Sit down or I kind of stretch it out a little bit.
Okay. How's sitting for you?
Sitting's okay.
Okay. So sitting doesn't make your pain any worse, any better?
No.
Okay. And then what about walking?
When my leg pains come on, I can't walk.
Okay. Does walking affect your back pain at all?
Not really.
Does walking make your leg pain worse?
No, I think it kind of makes it better.
So walking around makes your leg pain better?
Mhm.
Okay. Have you noticed anything throughout the day that brings on your leg pain?
No, it comes so sporadically that
Okay.
it can come on if I'm just sitting there doing absolutely nothing.
Okay.
I'll get sharp pains.
Do you notice that sitting brings on your leg pain for a long period of time?
I don't know if it brings it on.
Okay. Okay. And then what about sit to stand? Does that ever affect any? of
Yeah,
your
that
symptoms?
hurts.
Okay. Where does that? Which one?
But
Both of them.
Yeah.
So that makes your back and your leg pain worse.
if I'm feeling my leg pain, yeah, that'll
That-
make it feel worse.
Okay. So standing for a long period of time brings on your back pain.
Mhm.
Laying down brings on your back pain.
Mhm.
Sitting sometimes makes you feel better.
Mhm.
And then when you go sit to stand, that makes both of your symptoms worse.
Yeah.
And then walking typically makes things feel a little bit better.
Yeah.
Is that correct?
Yeah.
Okay, good. So have you found anything throughout the day besides kind of sitting and resting that helps relieve your symptoms at all?
If I go for a jog or for a walk around my neighborhood, yeah.
Okay, so just moving around.
moving around, yeah.
Okay, good. Have you noticed a time throughout the day when your symptoms are better, worse, or the same? Or better or worse, like the morning, afternoon, or the evening?
The morning is where I feel the best.
Okay, the morning, and then does it progressively
Yeah.
change throughout the day? Okay.
Mhm.
And then have you had any past history of back pain at all?
No, it actually recently just started. I started going to the chiropractor, so all my back pains have been within the past year.
When did you first start noticing this pain in your back?
I'd say about a little over a year ago.
Did anything happen? Was there trauma?
No, I mean, I've gotten into minor car accidents, nothing serious, but
Okay.
out of nowhere, all of a sudden my back has just been killing me.
And that was a year ago?
Yeah.
When did this leg pain start coming?
Oh, recently. I'd say within the past 2 to 3 months.
Okay. So from about 2 to 3 months till now, would you say your back pain and your leg pain is better, worse, or the same?
My back pain has been better since I've been going to the chiropractor.
Okay.
It still hurts, but it's getting better. My leg pain, it just comes and goes.
So
Yeah.
Okay. And then how long have you been seeing the chiropractor for?
About a year.
A year. Okay. And you feel like that's making a little difference?
Mm-hmm.
Okay, good. And then any other treatment for your back at all since then?
No, I mean, the chiropractor has me lay on certain pillows and towels, but other than that, there's no other treatment.
Okay. And then have you had, and you said no past injuries to your back besides minor car accidents in the
No.
past? Okay. And does this ever affect your sleep at all?
Sometimes, yeah, I'll wake up in the middle of the night and I can't sleep because my back hurts so bad. Or leg pain can wake me up in the middle of a deep sleep.
So both of them kind of come
Mhm.
on. How many times a night are you waking up?
It's not every night. I mean, it can happen maybe once a week.
Once a week? Okay. Does this ever make you have trouble falling asleep at night? because of
Yes,
pain?
definitely.
How long typically does it take you to fall asleep?
Hour and a half.
An hour and a half. Okay. And that's a typical night for you?
Yeah.
Okay. And then, so you've done chiropractor for about a year. Things are
Mhm.
getting a little bit better,
Mhm.
but still this leg pain is not, that just recently came on and nothing's changing with that.
Yeah.
Okay. Do you notice any change in your symptoms with coughing or sneezing at all? Does that change your symptoms?
When I cough, sometimes I can feel it in my back, but it doesn't necessarily bring out the pain, but I could feel it when I cough.
Okay. And then have you noticed any changes in bowel or bladder at all recently?
No.
Any numbness or changes in your saddle regions?
No.
Okay. And then any unexplained weight loss or gain recently?
My weight normally fluctuates as it is. So.
Okay. But no big changes from
No.
usual? Okay. And then have you any other past medical history pertaining to any of this?
No.
Okay. And what are your main goals for physical therapy?
I just want to start feeling better. I want to start doing daily routines without the annoyance of
Right.
these pains.
Okay. Are you doing any type of physical activity right now?
Here and there, yeah.
Okay. How often are you usually exercising?
Not as often as I should be. A couple times a week.
Okay. Does this ever affect you exercising? Does it make it harder? I know you said walking makes it feel better sometimes.
Yeah, it makes me not want to leave the house.
Okay. So it
So.
kind of makes you not want to go out and do
Yeah.
exercises. Okay.
Yeah.
Great. So what I'm getting is you're having this low back pain. It goes down your leg. This is just starting.
Mhm.
Your symptoms are getting a little bit better in your back, but your leg is kind of fluctuating.
Mhm.
And then so like we talked about, standing and laying for too long, laying down
Mhm.
are painful for you, and sitting down kind of helps relieve some of your symptoms.
Mhm.
And your main goals for physical therapy are just to start feeling better so you can get back to your normal activities and
Yes, exactly.
all right. All right, great. So I'm just going to put you through a little exam, and we'll just try to figure out what we think is going on here, okay?
Okay,
All right.
perfect.